My name is Sarah Heineman, and I work at Missoula Public Health. I currently am the Director of Health Services.
I'm Maggie Cook-Shamanik, and I am a public health physician.
My name is Laura Williamson. I'm the state epidemiologist.
My name is Neil Koo. I am the healthcare epidemiologist, and I serve as the medical director for the Infection Prevention and Control Program.
My name is Erica Baldry. I am the current section supervisor for the Infection Control and Prevention and Healthcare Associated Infections section.
There's some really great resources. I saw that Johns Hopkins has created a dashboard, a data dashboard similar to what they had during COVID. And so that's an excellent resource. Certainly local health departments will have up-to-date data if you have cases in your community, and the state health department has a lot of great information on their website as well. The CDC is also tracking the measles outbreak situation.
Montana DPHHS maintains a measles webpage where that is an excellent place to go for information about measles activity in Montana. We have a dashboard that includes case counts and an epi curve. We also link to other local health departments' web pages that they are maintaining on measles. And so that's where other health departments and the public can find information about measles activity and locally, potentially public exposures for measles, as well as any specific vaccine recommendations that local health departments or counties may have issued. Another great source is the Centers for Disease Control and Prevention measles page, and they too nationally hold a lot of great information about measles activity that's happening throughout the United States, as well as a lot of really great resources for healthcare providers, other health departments, and the public. So Montana has not seen a measles case since 1990. And our first case that we identified since that time was in April 2025. So that's been 35 years. But I can assure you that DPHHS and other local health departments throughout the state have been preparing, especially in the last 2 or so years, as we've seen other large measles outbreaks happen in the United States. And we know that measles is a disease that really has always been a car ride or an airplane ride away, and so it was very possible that we would see a traveler returning and bringing measles back home. And so what health departments have been doing is we've been reviewing recommended public health responses to measles, such as isolation recommendations, quarantine recommendations, vaccine recommendations. And we've been reaching out to healthcare partners, schools, daycares, and other partners in our communities to exercise what we would do in the case of a measles case coming to our community. And so DPHHS has been doing these exercises. We've been working with local and tribal health departments across the state to be conducting these exercises. These exercises look like tabletop exercises, which are exactly as they sound, where we bring a variety of partners who might be involved in the measles response, and we talk through a scenario, and everyone talks about what role they would play and what sorts of information might need to be communicated to them and what actions they might take. And so these have been really useful exercises for folks to get the cobwebs off, so to speak, and feel a bit more prepared should measles come to their community.
Each facility is going to follow their own protocol in addressing this, and it's best that you call ahead to alert them that you're coming and that you're suspecting that maybe you have measles so that they can guide you appropriately.
And the overall goal really is to isolate the patient or the person who is suspected to have measles, and as quickly as possible to alert local public health immediately. And if healthcare is needed, to ensure that you are calling ahead and talking to the healthcare facility and provider to ensure that when you arrive at the healthcare facility, the appropriate infection control precautions can be taken.
It's so critical that people call ahead of time before seeking medical care if they think they might have measles. And this allows the facility to put those protective measures in place to help protect other patients and the staff. They'll use signage and messaging about symptom screening. They'll ask you not to enter or to call this number to help guide people to access medical care safely. And that can be done oftentimes via the phone or telehealth, or they might come out to your car and then determine what's the best route for you to be seen in the facility if that's necessary.
So if a provider decides to test for measles, that indicates that they suspect the patient has measles, in which case that patient needs to be instructed to isolate at home in order to not to minimize exposure to others and wait for their test results to come back.
So travel or exposure to someone who recently traveled from near an area where there's been reported outbreaks is probably the primary the risk factor to consider. Certainly, there are also symptoms that can be listed.
So we're looking for fever, that generalized macular papular rash without vesicles. If you have vesicles, you think chickenpox. You're also considering the 3 C's, so the cough, the runny nose, or congestion, and then conjunctivitis. If you're a known contact to a case of measles, or you've had international travel or domestic travel to a known transmission area within the past 21 days. Yes, this is a great resource for medical providers to check vaccine records. Besides MTRACs or other state immunization registries, you can certainly look at other medical records or school immunization records, lab results such as antibody titers, things like that. DPHHS website has a measles care package that has a lot of great information in it. Certainly the CDC has good pictures, the American Academy of Pediatrics. There's the Control of Communicable Disease Manual, and there's also the Red Book, which they're both online as well, but I like my hard copies here. So
currently they're making that site of the measles component of the Red Book free for and the content to be downloadable and such to anyone. So I think that's a great site. Pediatricians are probably again much more versed because this is a disease that we more commonly saw in kids in the past. So they have a very, very good section on measles and what to look for and things like that.
hopefully they've called ahead and protocols were in place before they arrived. Following the CDC's interim infection prevention and control recommendations for measles in a healthcare setting, then depending on the facility, they're possibly going to use a designated area such as a negative pressure room, or they're going to make sure that that person's in a separated space. They may give the patient a face mask to wear. Staff hopefully are fully immune to measles and are wearing appropriate PPE, such as an N95 fit tested mask, a gown, gloves, and a face shield or goggles. And then cleaning and disinfecting all areas after the client interaction is complete would need to occur as well.
If there is a case that happens over the weekend or after regular business hours, local public health departments maintain their own 24/7 emergency call numbers. So be sure to know what your local public health department's off after hours number is. If you cannot get a hold of them, you can also call the state health department, and our after hours number is 406-444-0273.
For your local public health 24-hour contact line, I would recommend that you contact your local public health during the day and establish that protocol so you know what that process is if you need it after hours.
To start, make a plan and start to review your facility's policies as they relate to infectious disease. Measles is spread via airborne transmission and can remain in the air for up to 2 hours after an infectious individual has left an area. Review what education your staff may need, such as donning or doffing personal protective equipment or PPE, performing hand hygiene, environmental cleaning and disinfection, and transmission-based precautions, such as adhering to airborne precautions. Include all frontline healthcare personnel and your emergency medical services crew in training as applicable. Additionally, as part of the Centers for Disease Control and Prevention's core measles prevention and healthcare settings guidance, it is recommended that healthcare facilities ensure that healthcare personnel have presumptive evidence of immunity to measles. Additionally, facilities should promote respiratory hygiene and cough etiquette. Healthcare facilities should ensure that healthcare personnel are fit tested for a respirator and that staff know which respirator they're fit tested for. Facilities should check their current stock of personal protective equipment and ensure adequate supply is available. Create a patient flow plan. For example, healthcare facilities should determine where they will assess measles cases. So for example, will assessment occur inside or outside your healthcare facility? How will this be communicated to patients, visitors, or caregivers that are coming to your healthcare facility? Is your facility planning on posting signage at entry points of your healthcare facility providing information related to signs and symptoms and what to do if a patient is suspected or confirmed measles case? Or some facilities have even opted to use a stop sign with a phone number to call so individuals presenting know exactly what to do. We also have a few questions that you may want to ask your healthcare facility as part of preparation efforts. If a potentially infectious individual enters your healthcare facility, how will you perform contact tracing of exposed individuals if an exposure does occur? Where will you place the potentially infectious individual? Do you have an airborne infection isolation room or air? Or do you only have regular exam rooms? The next thing we'd recommend doing is assess your HVAC or your air system at your healthcare facility. Each healthcare facility is unique with what their HVAC or air system looks like. What areas of your facility are considered shared air? What are your current air exchanges? If you do not have an airborne infection isolation room or air, what's your plan? If you do have an air, does it work? When was the last time that you tested it? How do you monitor it? If you plan on transporting a patient to another facility because you don't have an air and they do, please ensure that that air is also in working condition. If you're going to be transporting via EMS, communicate the patient status to the EMS team prior to transport. And then finally, check your immune globulin supply. Do you have IVIG or IMIG on hand? Where will your healthcare facility provide this to an exposed individual? The current CDC recommendation is that exposed, non-immune individuals who are receiving post-exposure prophylaxis or PEP do so in an airborne infection isolation room or air, and that staff wear respiratory protection. Yes. Individuals who are suspected to have measles should be placed in an airborne infection isolation room on airborne precautions. If an airborne infection isolation room is not available, individuals should be placed in an exam room with the door closed. When possible, source control in the form of a face mask, if safe to do so, should be placed on the patient. Facilities should try to limit the number of shared air spaces where the potentially infectious individual is at to help reduce the likelihood of exposing other patients, visitors, or even healthcare personnel. Shared air spaces may include entryways, hallways, bathrooms, elevators, stairwells, or even patient care areas. Healthcare personnel should wear a N95 that's been fit tested or higher level respirator in addition to following standard precautions, which could include the use of gown and gloves depending on the cares being provided and the symptoms that the patient is exhibiting. DPHHS does. The Montana Infection Control and Prevention and Healthcare Associated Infections section has created several resources for healthcare facilities throughout Montana. Resources include a one-pager outlining the main infection control measures a healthcare facility should take as it relates to a suspect measles case, an in-depth measles infection control and prevention guidance document that summarizes the CDC guidance, a measles healthcare exposure risk assessment checklist, and a measles stop sign that can be placed at the entrances of healthcare facilities. In addition to these resources, the Montana Infection Control and Prevention and Healthcare Associated Infections section can provide infection prevention and control consultations to our healthcare facilities throughout the state. We always encourage healthcare facilities to work closely with their local and tribal public health partners, as they are a great resource and work very closely with our section. However, we are always more than happy to assist our healthcare facilities as the Infection Control and Prevention and Healthcare Associated Infections section. We absolutely love hearing from our healthcare facilities here in Montana. The best thing we can do right now is to start conversations about how healthcare facilities can best prepare for caring for measles cases. Facility level implementation of strong measles infection prevention policies and procedures will reduce community and healthcare personnel exposure when an individual suspected or confirmed to be infected with measles requires medical care, or an individual exposed to but not infected with measles requires post-exposure prophylaxis.
The most important thing you can do to protect yourself and your loved ones from measles infection or severe disease related to measles is getting vaccinated.
You can ask them to volunteer this information, but I would recommend working with your human resources department and your legal counsel to determine this for your organization. I think that if you ask them to volunteer it, that's allowable.
A very good question, and this is something that we've talked about quite a bit back and forth ever since the House Bill 702 had been was passed. The law specifically was targeted that we cannot discriminate employees based on their vaccination status, but it does not prohibit us from asking their vaccination status. So but the employee or the applicant, if they're is that they can volunteer that information. But if they choose not to give that information, we are allowed to presume that they're not vaccinated.
We're looking for standard and airborne precautions. So that includes the N95 fit tested mask, goggles or face shield, gown, and gloves. We want to wait for at least 2 hours after that person has left the room so that we're not using it or exposing other people to that space.
The 2 hours is the general rule for most for just regular patient rooms, and it's really actually dependent on the number of air exchanges that that room is set up to have.
So DPHHS has great guidance on the testing process of what you should order. There's two types of specimens that you can collect. One is a respiratory specimen, so throat, nasal pharynx, or nasal swab, and then a serum, and you're looking for the IgM serum. And they go into a lot of specifics about the timeline of which test is the best test to use in based on symptoms or the timing, how to collect the specimen, and how to get it sent to the Montana Public Health Lab. We want to be notified immediately if you're suspecting a measles case. You can use the after hours contact process, and this is going to be a little different depending on each local health department. And so if you don't know what the contact process is for your local health department, I recommend reaching out to your local contacts and establishing that line of contact for after hours.
For Yellowstone County, we have a 24-hour. County Public Health Office has a 24-hour line where you can call and leave a message, and there's usually someone who's on call for public health at all times for this.